Are doctors dropping out of Medicare Advantage? Do doctors like Medicare Advantage? And in general, doctors hate Medicare Advantage. I'll just say it. Because Medicare Advantage, every insurance company will negotiate with your doctor's office, with your hospital, how much they're going to pay them. And they all negotiate different contracts. As you can imagine, the bigger companies negotiate a less favorable contract to the doctor, and the doctors kind of take it or leave it. They have to take it because it's such a big insurance company. So the doctors are making less and less every year. And of course, they do not like that. So they get in little tiffs with the insurance company. Every once in a while they go, look, we're not gonna take that. So they go out of network, which is a big nightmare for you. Your doctor's now out of network, which means if you have an HMO, you can't see your doctor. If you have a PPO, which means you'll pay a higher fee to see your doctor, if your doctor will allow you to still go. So you're really inconvenienced. We, the insurance brokers, we look terrible because your doctor has been in network for 10 years, but your doctor's mad and he's out. So typically, after a year of being out, the doctor will crawl back to the insurance company because they lost so many patients that couldn't go there anymore. And they say, okay, we'll take your ridiculously low offer and we'll go back in your network. They don't like it, but it is a fact that they have to be in these networks. I won't say his name, but the president of one of the major hospital associations said that doctors are in a race to the bottom with Medicare Advantage because they're making less every year and it's killing the doctor's bottom line. And there's more people on Medicare every year, right? There's already 60 million people on Medicare. Medicare already reimburses low. Medicare Advantage reimburses even lower. And people on Medicare go to the doctor more than younger people. Doctors are not happy. Hospitals are not happy. And every once in a while, you'll see them start to negotiate, and it's all over the news. I got a client yesterday saying, she got a letter from her hospital. And they said, we might be out of network soon with such insurance company. Why would they send me that letter? That's like having a private marital fight. You guys should work that out on your own. I don't need to be involved until it's done. Once it's over and you're out of network, then I got to figure out what doctor or hospital I can go to. But while you're fighting, why are you airing your dirty laundry? Why are they taking out full-page ads in newspapers? Because hospitals are trying to get you upset and you to call the insurance company on their behalf and say, you better stay in network. You need to loosen up on our doctors. They're trying to involve us. And most cases, we don't become active. We just become mad or scared. We're not doing the things that the hospitals and doctors want us to do, which is help them put pressure on the insurance company to pay them more, to stay in contract. So it's ugly, but that is part of managed care. In a year where the government gives insurance companies less money, insurance companies have to find places to cut costs. So what they could cut staff, they could cut benefits. What are they going to cut? CEO pay? No. What are they going to cut? They could reimburse hospitals and doctors less. When those contracts come up for renewal, they could offer them 1% less. And doctors are losing their minds. So yes, do doctors not like Medicare Advantage? In general, and I qualified that, they do not like it. But there is a subset of doctors that, chef's kiss, loves Medicare Advantage. And those are doctors that are on a special contract that they share profits with Medicare Advantage. So if they can save money, I'm not going to talk about how they could save the company money. You can figure that out. But if they can save the company money, they can get a share of the profits every year. So those doctors love Medicare Advantage because they control what specialists you see, what medications they prescribe, if it's a brand name or generic. They control that, and they have the ability to help keep costs down, drive up profits, and that can enrich those doctors. So there are some doctors absolutely love Medicare Advantage. It's a small subset, typically on the West Coast and an HMO plan. But the rest of the doctors and the rest of the whole country, they're not big fans.
If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.